Hi, my name is Jenny Lauren Dowden for Conduit News, and today we have Senator Justin Boyd joining us to give us his impression of session. Senator Boyd is from Senate District 27, and that represents parts of Fort Smith. Hi, Senator. Thanks for joining us.
Hey, Jenny Lauren, how are you?
I'm good. Thanks for being here and for being willing to come on Conduit. You always give me a hard time anytime that I see you at the Capitol, and so I'm glad that you're here so that we can give you a platform to talk about all of your good pieces of legislation this past session.
Yes, ma'am. I appreciate the opportunity. It's
Well,
always
let's
it's
talk.
good for people to hear, what we have to say directly, and I appreciate the opportunity.
Yeah, I think so. Well, let's first just dive into your overall impression of the session. I'm not sure how many terms now have you served? What number is this for you
I am in my first term as a senator. I
as
had
a
four
senator?
terms as a state rep prior to that.
That's right. Okay, so just give us your overall impression now. You had multiple terms, as I remember, in the House, now in the Senate. What are your thoughts?
Like every single session, this session was different. I'm not sure that this session was different in necessarily a good way, but it was definitely different. I think that we did a lot of good things. We did some things that I think people are going to question. But at the end of the day, we did what we always do. We come together with a lot of different perspectives, and we try to do what we believe is best for the state of Arkansas and her citizens.
What did you hear most from the people in your district, from your constituents? What were they? What did they care about the most? What were they contacting you the most about?
I think that there were lots of different reasons. There was no one issue that came to the front and said, "Hey, this is the number one issue." I will say I did have some contact on some of the library bills that we had, and I listened to that. But I would also say that um, we I've seen some of the books, and when you're in the process and you're making votes, one of the things you always have to go back to is how did you campaign? What did you tell the voters? And I've very clearly campaigned on Arkansas values, and some of the things that I've seen that libraries had just out in the open for anybody to have access to, I just did not feel like they were reflective of Arkansas values. Now that doesn't mean that I feel like they should have been banned entirely from a library, but they certainly should have been placed in their own section or somewhere where it was clear that our kids didn't have access to that.
Let's talk about some of the bills that you filed. A lot of them, as we were talking off camera, were actually earlier on in the session. One of those specifically was the central banking currency. And I remember I was in committee watching this, and the dialogue was interesting. If I remember correctly, there was a Senate committee member who really wanted to make sure that um, some special interest groups really spoke into Senate Bill 133. Talk to us about that bill and why you ran that one.
So, unfortunately, I found out about that issue right as the 2023 session was ending. I had a constituent reach out and go, "Hey, Florida just did this," and this is one of the rare times when Florida gets out ahead of the curve and does something positive ahead of Arkansas. And so I had been working on drafting that bill for 18 months. I had worked with Wall Builders was one of the organizations who had some influence and input in doing that. So, what central banking digital currency is, if anybody doesn't know, it's where the government creates a digital currency that would replace our physical dollars. And when that happens, the government can control everything. They say, "Hey,
Yeah.
you've spent more money on gas this month, or you've spent your limit on gas this month, so we're shutting you off. You can't do that." And obviously that would be an absolute um, hit to freedom and liberty in the United States if that were to happen. So we are a state. We're limited in what we can do, but we do have 10th Amendment rights, and this is one where we could do that. So, do I think that we're in with the Trump administration, we're at high risk of that happening now in the next 3.5 years? Absolutely not. but we don't know what the next administration will bring. And we wanted to be on record as saying, look, we value our liberty and freedom and do not want the federal government to go down this road of central bank digital currency.
And it was shortly after I remember watching that in committee, the White House came out with something very similar. And I remember reading it thinking, I just heard something about this at the Capitol. And I even remember some Republicans being adamantly opposed to this.
There were some people who had some real concerns with it. Again, I don't think everybody, in fairness to some of those Republicans,
Sure.
I don't think that people knew I had been working on this for 18 months. I had
Yeah.
reached out to the banking association to make sure there weren't unintended consequences that we needed to know ahead of time. And I felt like, I mean, there was a reason when the state bank, the banking department of the state doesn't show up to testify against your bill, right? Or
Yeah.
express concerns. I mean, we had vetted all of those things in the beginning and felt reasonably comfortable that we were going to do what we needed to do to protect Arkansans and not, you know, inadvertently impact Arkansans in a negative way.
Yeah. Let's also talk about your right to try bill. Talk to us about that and why you believe that offers medical freedom to Arkansans.
Yeah, so that's another one that it didn't get a lot of attention, and it kind of flew through both chambers without much. There was a little debate in public health because again, it was several pages of legislation, but sometimes you have to have legislation to protect people. That it's unfortunate that it's that way, but that's in the society where we are. And so, what it's going to do is it's going to open up. We had in 2015 right to try that was passed. Right to try is not some backdoor to marijuana or something else. These are potentially legitimate cures where the medical system has basically exhausted all options, but there are other options, all approved options, but there are other options that are available. And so since 2015, there are more individualized therapies that are available. And what this does is it ensures that we don't have state laws that keep Arkansans from being able to access those. So they go to their doctor, they work with their doctor, his or her doctor, and they agree, hey, this is a terminal illness. There is, possible hope over here. And it uses red tape to get rid of the red tape that would prevent some access to those.
You also were a yes on a few bills that surprised me. I'm going to be really honest. And this is what you gave me grief about. We have our weekly legislative report where we track and analyze bills that have been recently filed, and we don't always agree eye to eye. Some of your pieces of legislation in Conduit, because at times some of those seem to be more favorable, and you can argue this, be more favorable to the medical industry or the healthcare industry. But there were some bills that I think were surprising that you voted for, and that was Senator Clark's over-the-counter bill for ivermectin. And then you also voted in favor of extracting Senator Penzo's fluoride bill, which simply repealed the mandate. But then you also voted in support of repealing the mandate. So the extraction and the bill, and then of course Senator Clark's ivermectin bill. Talk to us about those votes.
Okay, so the ivermectin bill to me was just straightforward and the right thing to do. So let me be clear: federal law still supersedes state law. In fact, I had someone come from Louisiana the other day who was ready to buy ivermectin over the counter, and of course, the law hasn't gone into effect yet.
Yeah.
But even then, there's still laws that keep the federal government determines what's a prescription product, not the state, right? So I gave a floor speech and I said this is the right thing to do because it would be safer for people to take what is prescription ivermectin rather than go to the feed store and buy ivermectin that is dosed for horses, right? There are, at too high of doses, there are some potential consequences. If you're pregnant, there are some potential consequences. So it's not an entirely benign medication, but I still feel like Senator Clark was absolutely right. It's safer to have access to the over the counter, to make it over the counter and let people decide. And
Yeah.
so I not only did I vote for it, I went to the floor and I actually spoke in favor of it and encouraged my colleagues to vote for it. And as you know, it passed. It passed both chambers, and our governor signed it, and it is the law. Still, though, I think it sends an important message to the federal government. Look, you need to look at this, change things.
Mhm.
This is a better way to do it. So, regardless of whether it has a direct effect or not, it still has an important effect in signaling to the federal government. Look, we want access to this. It's safer. It's better to do this and not tie our hands to the stuffed dose for horses.
Yeah. Also talk to us about the fluoride bill. Earlier you said when talking about I think it was a central banking currency bill, you said, it's rare for Florida to get ahead of Arkansas. I don't know if you've recently seen the news. DeSantis just signed a bill. Health Secretary RFK mentioned Florida and how great they were doing with their Make America Healthy Again legislation. They repealed the fluoride mandate in Florida just this week. And I was like, Arkansas, that could have been us, but we couldn't get it out. One, tell us why you supported repealing the mandate. And then two, tell us why you believe that was such a heavy lift. It had a really difficult time getting out of Senate Public Health. Of course, the chair of that is Senator Missy Irvin. It is not a secret that she has very close ties to the healthcare and medical industry. I think that, of course, could be a large hurdle. That could possibly be one reason why Senator Penzo had to extract it out of there. But just give us your thoughts on that bill.
So fluoride, as you know, has been controversial for years, right? There is evidence that it helps with our teeth. There is evidence that at significant doses it affects our kids' IQs. But I think what it really came down for me was Fort Smith has had a history of voting against adding fluoride to the water, and it's exactly what you said. It's a state mandate, right? So it's a state mandating something that the people of Fort Smith spoke three times saying, we don't want this, right?
Hmm.
And I didn't have any new signals that the people of Fort Smith wanted something different. But I do know that there's a lot of more discussion, there's a lot more information, and there's a lot more questioning of the value of adding fluoride to the water. And so I felt like if I'm going to represent the people of Fort Smith, I need to represent the people of Fort Smith. And this is one of those unique occasions where I have a vote of the people of Fort Smith, not just once, but three times where they said no. And I
Yeah.
felt if I'm going to represent them, then, you know, they're going to have to give me a really good reason why the state should have a mandate on it. And I only heard from people who wanted it out. I don't recall hearing from a single person who wanted to keep the fluoride in the water. And so that's why I did it.
Yeah, that's really interesting. I didn't realize that Fort Smith had been voting on that.
It hasn't been in a while. And, so
Okay.
you could say, well, maybe Fort Smith has a different makeup. But at the end of the day, look, you use the information you have. And the
Yeah.
information I had was that the people of Fort Smith had said three times, we don't want to add fluoride to our water.
Yeah.
And therefore, that's what I felt like I needed to do is represent the people of Fort Smith.
Yeah. Talk to me about the Franklin County Prison and your constituents. That's kind of in the same area in a way. There's talks of, there's been a lot of discussion about the prison. As you know, it's been voted on a lot. You have been an advocate for that prison, whether it's been in, joint budget and discussion there or on the floor. What are your constituents saying when they contact you? And there's also been discussion about having to regarding utilities and water usage from Fort Smith to Franklin County. Talk to us about that. What are your constituents saying? Do you still believe that that is the best use of resources, the best use of funding? the best thing that can be done to correct this problem right now?
Jenny, I'm glad you brought this issue up. This is an important issue. So at the end of the day, this is what's going on in Fort Smith or Sebastian County. It's
Yeah.
not just Fort Smith, it's the entire county. So 46% of our people in our local jail were state inmates. The state doesn't reimburse the county adequately to house the inmates. One, two, when you fill a jail with state inmates, people who rightfully belong in a state prison, not a county jail, then you tamp down on misdemeanor justice, right? And that's part of our justice system is to do misdemeanors. But people who have committed felonies, rightfully so, get priority over space. So what I would say is my vote is less reflective on a location and more reflective on an overcrowded jail where there's been discussion that Sebastian County should tax itself a penny more to expand its jail. So why should the people of Sebastian County have to tax themselves more to expand our jail to house state inmates while the state sits on $3 billion? So that's my view is we need a prison. It's less about my vote is reflective that the prison needs to go right here. I still believe we have to do the design build phase. And I think there are some questions that might come out in the wash, right?
Yeah.
But until we get there, I don't think we know. So, I know that some people will say, no, your vote means this, or no, what my vote means, I'm the one making it. My vote means we need a state prison. And it's hogwash that somebody is saying that Sebastian County should tax itself more. There's nobody I know of in Sebastian County that wants to raise a penny tax so that we can expand our jail, especially knowing that the state is the primary reason why we would even be having that. So I think that's an absurd argument. And I would say that is why I continue to vote in support of a new prison.
Yeah. I assume, I don't know for sure, are you referring to Senator King's suggestion for Sebastian County?
Yes, I'm trying to leave names out of it and not be direct.
Well, I don't
But
think he has any qualms after looking at his Twitter. I don't think he has any qualms talking about it, but I do know that he has talked about just expansion or, additional space in particular counties. And I know that he's mentioned Sebastian. And I think maybe his frustration
so
is just that there's been no consideration for any other options than just like tunnel vision for Franklin County.
well, maybe he's frustrated with that, but I'm frustrated with Sebastian County having to house state inmates.
Do
And
you think that
then
that is happening in a lot of counties?
I do. I
Yeah,
think that's why
yeah,
overwhelmingly what you're hearing from county judges and sheriffs across the state is we need a new prison, right?
yeah.
Right now, that happens to be the location that has been selected. Uh, but again, I think we've got to do the design build before we ultimately know. I think this is a step through the process, right?
Mhm.
But I do know that we need to do that. I will also say, I don't obviously I don't like to use the word progressive because that sounds left leaning, but I'm going to use it because it's the really the best way I know how to say it. So in Sebastian County, we have drug courts, we have mental health courts, we have
Mhm.
DWI courts, we have crisis intervention training, we have a crisis stabilization unit. We have done all the things that those people on the left have said we should be doing in order to make sure that we are locking up the bad people and trying to make sure the people who are sick get health care, right? Obtain health care. And so I would say there's not another county that has done more to try to ensure that we are placing the right people in the criminal justice system versus sending people into the healthcare system, right? Maybe there is, but I'm not aware of a single county that has done more than we have to try to take the pressure off of our county jail. And now it's time for the state to step up. That's why I've been so vocal on this issue is because, look, we have bad guys and they need to be behind bars, and that's gonna, cost money. Also, I would like to say that, I pointed out to Senator King, not, but I pointed it out to all 34 other senators, with one exception. No, I can't think of anything other than one exception where anybody tried to say something's not a crime that, you know we've called a crime and made it not a crime. I can't think of a single situation where we said we're going to reduce the sentences on this set of crimes, right?
Mhm.
All we did is we said we're going to be tougher on crime. Well, when you do that, you have to have space to house people or it doesn't work. Otherwise, so we have to address the space issue in the prison system.
Are you concerned at all? And so we know that there's been a certain number of money allocated already. Um, and you have said it, other people have said it. Well, we've got to get into the process and see what it looks like. We're in the design process, get further down the road. Are you at all concerned that this is just going to be a big money pit? And Arkansas is small, our budget is small. We're looking at potentially over $1 billion. That is a lot for our state budget. We've increased spending. We have passed legislation that grows government, has a lot of spending attached to it. Um, are you at all concerned about that if if the prison stays, which it appears to stay in Franklin County, and you all continue down this road and the cost continues to increase, allocations continue to be made, and is there a concern for you regarding government spending and what this will eventually cost taxpayers?
So what I would say is, again, we sent a signal that we wanted to be tough on crime. We want, in order to do that, we have to have places to put them. We have invested in Sebastian County on lots of ways to make sure we're locking up the bad guys and helping the people who have health care issues obtain health care. We've also done that
I
in our
understand, but
prisons.
and I understand, but and I understand, but are you concerned though about the cost of the prison and what that will look like? Is
None
that
of us.
or is the cost, is it just, and I've heard this verbiage before, and no price is too high to lock up, like is that kind of the mentality that we are taking, is no price is too high to lock up people, and is that where we're going with the Franklin County Prison, do you think?
Well, I mean, are you saying we should let the bad guys go?
No,
I mean,
that's not
that's
what I'm saying,
that's
but I think that especially as
so.
conservatives and with the taxpayer money, it is imperative that we be fiscally responsible, and um, we can't just simply operate with a blank check. So I think that there has to be obviously checks and balances, and you can't just operate as if you are walking around with a blank check and it's just going to be whatever it will be. And I don't think that that's the intention. I really do not.
So,
But
Jenny, I think always the government is doing things. We're course correcting. We looked at learns. We implemented something and we made some modifications this time. Uh, then we came in and we hadn't really addressed higher ed, so we addressed that. So I think that it's always a concern about what things cost. I think that it's something that we have to continually look at. We've got to monitor our budget just like anybody else. I mean, we could get all technical, but for the most
yeah,
part, we can't spend more money than we have coming in. And I don't think that
yeah,
you have a legislature that is willing to raise taxes. So I think that we are going to find a way to manage those. I'm
yeah,
confident of that. I still think we're going to find a way to cut income tax again. I don't. We've already cut it several times. I think that we are in the process of growing our economy. I think that We had more people moving into Arkansas last year. We were number one in that. We've had growth in the last 2 quarters in Arkansas. And I think that we have to continue to reflect to the businesses of the world, we want you here, right?
Yeah.
Um,
Yeah.
so there are specific types. I mean, we want manufacturing because that's money that's outside of Arkansas that comes in, right? Our tourism economy continues to grow. When we're bringing dollars with the people from outside of our state into Arkansas, we're growing. So we have to grow our economy in order to continue to spend money and continue to work on reducing the income tax and hopefully getting to the point of eliminating it. Right, that's the goal, and I would love to see that. I mean, I pay income tax too, right? I'd love to have to cross the finish line on that.
You know what? That is something that we at Conduit will certainly agree with you about. So I appreciate that. And I appreciate you answering the hard questions on the prison. It certainly wasn't, meant to be contentious. I just think that it's something that um, we just need to keep an eye on with the spending. And I know that you're aware of that. And so
Well,
I
it's
appreciate
not
your
contentious.
candor.
It's important that we have the discussion. Otherwise,
It
people
is.
only hear this one little microcosm, or you know, nobody was elected because they want to go spend $750,000 or $800 million, or like you said, maybe it's going to be more
Yeah.
until we get to the design build phase.
Yeah.
Then I don't. But that's again where the
Yeah.
legislature has to do its job is we ultimately are the power of the purse, and
Yeah.
ultimately we're going to decide, is this the investment we want to make? So I think
Yeah.
that we're having those discussions. I think we will continue to have those discussions, and I think I appreciate the opportunity to talk on it because again, most news media just put us all in one bucket, the people who voted for it.
Sure.
And then
Sure.
people want to fill in the blanks on what that means. And, people again can say what they want, but I was
Yeah.
the one casting the vote. And it's a
Yeah.
reflection of what I perceive the state of Arkansas is doing to Sebastian County, and this just farce of an idea that we should tax ourselves more to take care of the state's problem.
And I understand. And the only other thing that I would mention, and I think there are a lot of people who feel this way and also feel the unelected, just your normal everyday citizen who did not, a lot of them conservative, Senator Boyd, who did not necessarily agree with the direction being made of the prison. They were also categorized as, and as being, a leftist or, not conservative or whatever. And I think it is a very manipulative argument to make that, what, do you not want to lock up the bad guys? Um, if you don't want this or if you question that, and I would just, in the same way that you don't want, or that maybe some legislators don't want to be pigeonholed because of a vote or some way, if constituents have questions or raise a red flag about, hey, this looks a little off to me, all of this, this prison build and the questions, that does not mean that they don't want to lock up the bad guys. And so I would just, moving forward, I would just offer that suggestion to those of
So
you who across constituents that have questions about it.
yeah, so again, I come back to Sebastian County specifically and the
Yeah.
things that Sebastian County has done. We are compassionate conservative people in Sebastian County, and we want criminal justice, but we also want to make sure that we do what's right for everybody. And if people are sick, what helps is to get the health care, right? Not put someone with extreme bipolar disorder in a prison. That's not good for the
Yeah.
taxpayers, and
Yeah.
that's not good for anybody involved.
Yeah.
I would also say though, the state has done a lot too on work to reduce recidivism. We understand, and we can't just do one thing in a silo all by itself. When we passed, the legislation last session, there were a lot of things in there to help reduce recidivism. We we expanded on that this time as well. So we understand that it's expensive to house people in a prison, and we want to do everything we can to keep our streets safe and keep our Kansans safe, but at the same token, make sure that we have an intact, functional criminal justice system.
Yeah. Okay. Let's end on a good note for you. One bill that you were that we talked about offline was a PBM bill. That was, let's see, that was, I believe, House Bill 1150. Is that right?
Yes, ma'am.
Talk to us about that and your thoughts on getting that through.
So, of course, let's disclose for the audience, I am a
Yes.
pharmacist. So it was not my bill, but I
Right.
represent the citizens of Fort Smith, and we had a situation where we had a small chain of, it's three independent or three pharmacies. So some people would call that a small chain, right? It was Health Depot, and they folded into Walgreens. And I was the one, as I was out in my community, I would see those people. I would hear from them. They didn't understand it. They didn't like it. They were upset by it. And that wasn't just, hey, somebody wanted to, sell to Walgreens and make a bunch of money. That was not what was going on. It was, they were trying to figure out how to manage in a challenging environment. So what happens is there are pharmacy benefit managers, short, PBMs for short,
Yeah.
and they are both in the insurance business and in the healthcare business, in this case, specifically the pharmacy business. And so they're the ones who set the formulary. They tell you which drugs they're going to pay for and which ones they're not, right? They're the ones who direct you to say, hey, here's the preferred pharmacy or not, right? They're the ones who set your copay and say, hey, this is, if you go here, it's going to be this copay, right? So they ultimately set the price, tell people where to go, and they're doing that all against their competitors, right? That's
Yeah.
not American. The one thing that brings out innovation is not, hey, how can we like eliminate the competition? It's what can we do to support healthy competition, right?
Yeah.
And so what House Bill 1150 did is it just said, look, make a choice. You can either be a pharmacy in Arkansas or an Arkansas licensed pharmacy, or you can be a pharmacy benefit manager. But
Mhm.
it's not good for Arkansans when you do both. And I
Yeah.
think if you look back to the Federal Trade Commission, and they had a couple reports that came out not that long ago that showed some of the egregious examples. There was one, and now if you talk to them, they'll be like, "Oh, that's just one." Well, it should have never happened, right? Like
Right.
there was a case where the local mom and pop pharmacy, if you will, was getting $100 for the medicine, and quite frankly, based on what that medicine cost, the local mom and pop shop would have been very happy with the margin, and the customer probably would have been happy. But no, they were still directing people over here to the chains where it was, a couple $1,000s or so. I don't have the exact slide in front of me, but the more egregious thing is they were directing patients to their own pharmacies where it was about 19,000 plus dollars.
Good night.
Yes, and this is a cancer drug, right? Like this is an emotional time. People are worried about
Wow.
being, sick and want to get better and be healthy. And
Wow.
instead, you have the people who they're paying to give
God.
them good care, to help pay for good care, directing them somewhere else. So it's
Wow.
one where, you know, again, I have some bias, but the facts are the facts. You can't change
Yeah.
those. And
Yeah.
it was a corrupt situation. And I think they'll still come back and try to fight it. I think that we are on good grounds with, by basically states can control licensing, and we control both of those licenses. And we said, hey, you can do one or the other, but you can't do both.
Hmm. What do you say to those who argue that this reduces access? And I've, interviewed other people who say, well, this, over 600 people, will be out of jobs, and this, is picking winners and losers. How do you respond to that?
So I think that taxpayer dollars and your healthcare premiums were being used by three large companies in particular, for them to pick the winners and the losers. They were using their size and scope and making the rules by paying their competitors, directing patients a certain way. They are the ones that were doing that. So it's just kind of like, the people on the left who they accuse Republicans of doing things, but it turns out really they're the ones that are doing it. I think it's a scenario like that, Jenny, where, they're saying, hey, all these things, but they're the ones really doing it. And I think it was time for the government to step in. If there is competition, I think that as long as there's healthy competition in the marketplace, pharmacies are going to backfill and take care of those needs. There is a stop valve or a catch release or whatever you want to call it, where if there's really no other way, then the state of Arkansas does have an ability to keep a license. But I think those are just all, noise for covering up the reality of what's really been going on. And when people find out how much they seemingly have been overcharged, I mean, honestly, I'm not so sure it wasn't criminal, but I don't make that. I'm not saying it was. I'm not an
Yeah.
attorney. I can't go file that. But I've seen some data where it was significant.
Yeah.
The price differences that they would pay over here versus over there. And when you're the one who, again, determines where those patients go on some level by incentivizing it, and then you're paying yourself more, which was illegal in the state of Arkansas. So we
Yeah.
try to send the message and say you can't do this, and some of them will say, hey, we weren't doing it, and then I'd see examples where they were, right?
Yeah.
So I
Yeah.
think that the people there are the people who are employed will find jobs. I'm confident of that. I think where there are access issues, I'm confident that those will be taken care of as well.
All
I
right.
think the market's going to have a chance to work.
Let the market work. All right, we'll see. You're off the hook. I have a few more questions swirling around, but I'm not going to press you any further. We're out of the session. Let's move to Arkansas primaries. What are your future plans? Have you announced your reelection campaign yet?
I have not announced a reelection campaign. I guess I'm announcing to you first that,
Are you? Okay.
yes,
Well,
yes.
so
So,
tell us your plans.
well, I plan to run again. I think it's that simple.
All right.
I appreciate the opportunity. I mean, it's been an honor to serve the people of Arkansas. No matter who you are, nobody agrees with you 100% of the time, but I believe that I have done a good job in representing the people of my area. And I hope that I have the opportunity to represent them another 4 years.
All right, well, you heard it right here on Conduit News. Senator Justin Boyd announces his reelection campaign.
And you told me there wasn't going to be anything controversial.
Honestly, I have several other things I could have asked you about, but I thought, you know what? I just appreciate him coming on and talking to Conduit. So thank you for that. And I hope that later on, as we get further into the primary season, that you'll come back and talk to us.
Okay. So,
Well,
well,
thank you
thank
so
you.
much. Yeah, thank you. Hope to talk to you soon.